So I do think it's a slightly artificial question. Is it EPA or DHA? But having said that, no question that for depression, EPA or EPA-rich supplements appear to be performing best. Also, interestingly, in the area of heart disease, cardiovascular disease.
Yes.
Now, again, we don't have enough good, big studies that are rigorously carried out, but there is one called the Reduce It trial, yes, that is using pure EPA. It was more than 8,000 patients, followed for more than 5 years. It's a multi-center international study, and they used pure EPA.
Yes.
And found on top of statin medication, all of the patients who joined the trial were already receiving the best medication available, about a 25 to 30% reduction in every one of their major, cardiac, major adverse cardiac events. Again, this is just stunning. Whereas one of the things they're still not really sure about, because most trials are not as big and as long and as comprehensive as that, but might DHA, rich supplements might DHA be getting in the way? Now, I'm very wary, I really am, of any individual nutrient, and particularly if it's being sold as a magic bullet, because that's not how nutrition works. We have to remember that all natural foods, Peter, if they provide EPA, they also provide DHA, okay? And vice versa. You do not in nature find one without the other. I'm also going to emphasize fish and seafood again, because zinc, iodine, vitamin D, selenium, and, and a whole load of high quality B vitamins, high quality protein. This is it. Fish is a complete package.
Right.
So again, we're expecting a lot when we researchers are asked to do randomized controlled trials, pick out a single nutrient and get it right. But yeah, for the clinician, if there are mood issues, I would say emphasize, make sure that there is ideally at least 1 gram of EPA in there. But if there are issues with vision, with visual perception, that's about going to be your quickest clue without running the blood tests. Again, I should perhaps say, and you know this, Peter, it is now fairly quick and simple using a finger stick method, drop of blood, to get reasonably accurate, no question, measure of blood omega-3 and something called the omega-3 index. That is, what proportion of total blood fats are EPA plus DHA? As a rule of thumb, as a general guideline, less than 4% EPA DHA in your blood, you are at very high risk of heart attack and stroke. That is well established, the cardiovascular risks. The ideal is to be more than 8%.
Right.
But to look at those blood fatty acid profiles can also help to address this question of might EPA versus DHA. But yeah, if somebody is low, I'd be reluctant to give, just a high single dose of just one or the other. I would want to give some ratio.
About 6 weeks ago, I had an interview with Bjorn Daiberg, and I placed him the same question.
Yes.
I said,
pioneer, yeah.
Would you prefer EPA and DHA? And he gave me a very nice answer. He said, vitamin E, vitamin D, vitamin C.
Exactly.
Which one is better? All of them are good. We need every one of them. Yeah,
keep having to explain to people that they're not called essential nutrients for nothing. You need all of them.
Right.
If we had a medical system that started when any patient came into the surgery, if it started by asking, what essential nutrients are you lacking, and actually tested that and corrected that, a huge proportion of illness, disease, sickness, symptoms and death would just vanish. Yeah. Why don't we do this? But you know the answer, and so do I, Peter. The answer is our whole system is based on patent and profit.
Yes.
If you cannot patent this and sell it at a profit, then there is no incentive for this to be developed. This plagues nutrition research. It leads to things like I happen to know the history of the Reduce It supplement because it's exactly the same supplement that was developed by a man called David Horrobin, a medical doctor, but he was a lot more than that. And it is exactly, it used to be called Lax 101 in those days. But that's what we used for our single case of depression and our single case of schizophrenia. They were given pure EPA.
Yes.
Exactly. At high doses again. You want, as I say, at least 1 to 2 grams a day for depression. This is another one that can be very difficult to achieve from fish and seafood alone.
Yes, yes. By the way, you mentioned anxiety. There is another area where you work that was sleep disorder. I know there are many people which are affected by that. Yes. How does omega-3 actually help? Do you have the mechanism? Do you how that may help?
Mechanisms. Okay, we could be here for another half day, Peter. We better read.
If we carry on like that, we will.
The mechanisms are there. There are just so many of them. But okay, something I noticed very early on, across conditions, it almost didn't matter which condition. When you give long-chain omega-3, you see reductions in anxiety. So I've been surprised. Why has it taken so long, given that anxiety is really part of almost every psychiatric condition, together with sleep problems usually? Why is it that those have not been studied, whereas other diagnostic labels have? But there are enough randomized controlled trials now to really be able to say that, yes, if anybody has anxiety, stress, a long-chain omega-3 supplement is very definitely worth trying. Mechanisms, I will offer the HPA axis, the hypothalamic pituitary adrenal. Again, medics know about this. The general population certainly know about they call it the fight, flight, the stress reaction. Yes. Basically, omega-3, long-chain omega-3 help to calm an overreactive HPA axis. They help to keep under control that burst of cortisol, adrenaline, etc. They calm things down. That's a very simplistic way to put it, but the research is absolutely there. So for anxiety, now sleep, Peter. I was doing my very first trials, 20 years ago, randomized controlled trials. The most common anecdotal report from the parents was, oh, it's wonderful. He's actually going to bed at the right time and going to sleep. And I was hearing about these improvements in sleep. And I'm thinking, crikey, somebody needs to study sleep. Because I'm going to say again, there is no psychiatric or psychological disorder where your sleep is not disturbed, okay? But it's usually peripheral. It is part, actually, of the criteria for diagnosing depression. Different aspects of sleep can very definitely be, one of the tick boxes for that label. But we know it works both ways. If your sleep is not good, or you are simply not able, because of your job or because of noisy neighbors, whatever, to get enough sleep, what is going to suffer? Your mood, your behavior, and your ability to learn, and your ability to safely drive a car, for example. Do you see what I mean? It is extraordinary, but yeah, I wasn't even able until we published it in 2014. I did manage to put a measure of sleep into our study, one of the biggest studies of the general school population, where we were asking, can we improve their reading? Can we improve their behavior? Can we improve their cognition? The answers to those, incidentally, yeah, in the general population of 7 to 9-year-olds, we were able to improve the reading of the poorest readers. We were able to reduce ADHD-type symptoms, and this was in children who didn't have a diagnosis. They were just children. But sleep, marvellous. Now, 52% of a study that had 362 children, half of them had clinical level sleep problems. These were just ordinary children that's right, in British schools. Good grief. This was using, a standardized for the UK population questionnaire, the parents, quite a detailed one. Good gracious. Now, if we focus, therefore, if the children had sleep problems, did DHA improve their sleep? And the answer was yes. It significantly improved their sleep. We also, in a subset of children, we recorded sleep objectively using a little wristwatch type thing called an actigraphy, monitor, using actigraphy. Because again, how would the parents know if the child wakes up in the middle of the night but doesn't wake up the parents? This is it. Peter, it was stunning. It was 59 minutes more sleep. That's nearly an hour.
Hour a day.
We're talking a few minutes here. We're talking 1 hour more sleep. So I do know that a couple of years later, no, it was 2018, there was one of the studies of omega-3 for depression. From somewhere in the Middle East. They managed to measure sleep as well. And yeah, as well as improving depression, anxiety, emotional regulation. Yep, long chain omega-3 improved sleep. But why don't we have more studies? I'm afraid the answer, Peter, to that comes down to funding again. Yes. And patents and profits, because you will know the manufacturers of food supplements do not exactly make the profits that the pharmaceutical companies do.
Yes.
So they are not able, and they would not have exclusivity of any kind, even if they spent millions of pounds to finance the large, rigorous trial. But I think that being the case, when you look at how much research in this last 20 years has been done by researchers like myself, you don't do this in order to promote your career, quite frankly. You don't.
Right.
You do it because you think that it's important. You can see if you are somebody who works on the front line. Because yes, we certainly used to have, it's been closed for lockdown, of course, an actual research clinic attached to, our group at Oxford University, where we would assess children with dyslexia in particular, or related conditions, but letting them know we are doing research here, and some of that may include, treatment studies if you would like to consent and join. Yes. That's how we've been able, using essentially minimal resources, to do some of the studies that have shown quite remarkable benefits. But of course, we need more studies, we need larger studies, we need replication.
Yes, I could imagine. Now, maybe one more thing, because I see we're as expected, we're running out of time.
I told you we would.
Moving to the older age. Do you believe it is, let me put it quite drastically, is it worthwhile to supplement our brain when we get older in order to look, we cannot stop, but maybe we can slow down a little bit the cognitive decline by supplementing DHA and giving our brain, because as far as I know, while we are sleeping, our brain can actually replace oxidized and, let's say, damaged DHA out of its membranes. So,
right, and it can flush out those toxins via the lymphatic system that was only discovered a few years ago. Sleep matters. Okay.
And DHA should be a good formula to at least slow down a little bit the process. What do you think?
I think I'm more than willing, we might need to book it in a few weeks' time, Peter, but we can do a separate one on this and cover more of the issues that are critical if we are going to prevent so much of the burden of disease, physical and mental, that goes with aging. Cognitive decline and dementia. The very first controlled trial using omega-3 alone, fish oils, was in 2006. They found that in patients with Alzheimer's disease, bit hopeful to try to reverse established Alzheimer's, they found benefits only in the early stage patients, but okay. Now, as research went on and more trials accumulated, omega-3 alone, they may help some people, but what became clear is other nutrients are needed too. Now, other studies of key nutrients that are often lacking and are needed to prevent brain shrinkage, cognitive decline, dementia, the B vitamins, and in particular, B6, B12, and folate. Professor David Smith at the University of Oxford in the pharmacology department A randomized controlled trial recruiting from a cohort study he had built up and was following, that showed improvements. They used brain imaging to confirm reduced cognitive decline in elderly people, and reduced brain shrinkage from B vitamins. So they did get an overall result in that trial, but when they looked at their other data, they found that result was being carried only by the people who had enough omega-3 at baseline, okay? In other words, the entirety, when you focused on those who were adequate in omega-3 and gave them B vitamins, good grief, you arrested brain shrinkage almost completely. That's where the effect in the whole group was coming from. If you did not have enough omega-3, the B vitamins did nothing. So this was a very clear example of synergy.
Yes.
If somebody has enough B vitamins, then giving them omega-3 will help. If they don't, it won't. They then went back. It was those same researchers who had been collecting some measures in the very first trial, and they found the exact complementary finding. When you give omega-3, it only works if you have enough B vitamins, because they had a measure of homocysteine. That is a toxic product that builds up if you don't have B6, B12, and here we go. We also know the mechanisms here, because quite frankly, getting omega-3 into your brain is not an easy thing. And I don't want to get too technical, but, you know, lysophosphatidylcholine, and that's the one that is likely to be enriched in DHA and that will be escorted across the blood-brain barrier. So again, so many things here. Nutrients, you need all of them. One more thing, though, is that very recently, just last year, was the longer term follow-up of an EU-funded study, which was looking at a combination of nutrients. 1.5 grams of EPA and DHA were part of it.
Okay.
But this was a theory-driven recipe that began a long time ago, and just thought, if we want to prevent the breakdown of neurons and brain cells and prevent cognitive decline and dementia, why don't we give all the nutrients needed to build membrane? There's something called the Kennedy pathway, by which, you know, the assembly of what's required to renew, repair, or build brain cell membranes. So that's why you need a lot of long-chain omega-3, but you also need not just the B vitamins, but other nutrients. That trial, the EU double-blind trial in humans, that came good, really. You are able to, with again a multi-nutrient formulation, significantly arrest the progression of cognitive decline and dementia. They too had brain imaging measures.
That is so important, and such a shame that it's not really more known, right? And more
exactly.
I mean,
well, I think the major problem here, Peter, is, and you know this, our doctors, our health professionals are not taught about nutrition. Okay, they're not. So again, if you are not even made aware yourself, and a lot of this research, again, is relatively recent. So even if your training, you know, had been 10 or 20 years ago, unless you are able to keep up with the research into diet and lifestyle factors, then you're not going to be able to help your patients with that kind of information, even if your practice allowed you the time. But here in the UK, we are getting some GP, general practitioner practices, who are really seeing the value in having as part of their practice a nutrition professional.
Right.
They can, exactly, because they only get a short time with each patient. Their main role, and my goodness, there's enough they have to learn to do that well, is the assessment for drug and medication and medical devices, or is an operation needed? Yeah, we can't expect doctors to be experts in every detailed aspect of nutrition. But I do feel that it really has become imperative now that something is done to give doctors more basic education in what aspects of nutrition and diet are evidence-based now for which conditions. So I come back to depression. As I say, there's some very good treatment guidelines now based on the highest quality of evidence. We're talking meta-analyses of randomized, double-blind, placebo-controlled trials, and they go into a lot of detail. So these kinds of publications, and also online training, as of course, this is what I'm busy helping you to provide for some of your doctors, to be able to just find out, oh, hang on, this isn't just something in some color magazine, you know, that's just nonsense. Yes. Because this is it. Nutrition and diet have a bad name because, of course, there are a lot of people who choose to exploit the ignorance of the general public and some professionals by making ridiculous claims, but as the foundation of all health. Again, the long-chain omega-3, as you will know, Peter, one of their many mechanisms, good grief, you know, they influence gene expression. Yes. And again, not enough people, certainly in the general public, know that it isn't just what genes you inherited, it is how are they expressed, how are they regulated. At the very basic, a gene is, or coding gene, is a recipe for making a protein. Yes. Well, it can't make that protein if the raw materials aren't there. So again, if your diet is lacking of the amino acids needed to assemble it, then whatever genes you've got won't get very far. That, of course, applies with serious, you know, protein malnutrition. I would not say that's a problem for most people in most developed countries, but it is for those with severe eating disorders, like anorexia, or what we are seeing now more and more, the autistic spectrum of disorders. And again, it's a whole spectrum, like ADHD. There's no single thing called autism that makes everyone exactly the same. But yeah, some avoidant, restrictive, very selective eating. We have had cases now, too many, one is too many, of children who by the teenage years, they are now blind. And in one case, deaf as well. Mother has now had to give up her job to care for this 17-year-old because, yeah, the nutrient deficiencies were so severe. They were spotted when he was 14, but his diet of ultra-processed rubbish left him so deficient in vitamin A in particular, is, you know, one of the key nutrients without which you will go blind, your immune system won't work. But similarly, the long-chain omega-3, if you're deficient enough in those. So we cannot ever assume that patients are well nourished. Ultra-processed food diets, Peter, and what I see, because I am still on the front line, seeing what school children and the general public, and parents who tell you what their child will and won't eat. And I'm thinking, you are the parent. Yes. While that child is in your house, it is your responsibility if we can improve. That's right. But again, if the child attends school and follow, this is shocking. This should not be happening.
You're absolutely right. Well, look, I would love to keep on talking with you for
let us focus on, you know, future areas, book something in, and we can, if you want to, explore in more detail, perhaps one condition at a time, because that is often how clinicians work. Right. We've tried, of course, to cover a lot of different things.
Maybe a few more words, if you can tell us a little bit about your foundation you created and what you're doing over there. And yes, tell us a little bit about your research.
Thank you, Peter. Food and Behaviour Research, or FAB Research for short. The website is fabresearch.org. It is a small researcher-led charity that I basically set up almost 20 years ago now, with the help of the other researchers in this field. Now, that includes the likes of Michael Crawford, who is an absolute pioneer in this field. Also, Joe Hibbelin from the National Institutes of Health in the US. He really, you know, pioneered the work on omega-3 and depression. Bernard Gesch, who led the studies showing that antisocial behavior, doing studies in a high security prison, he showed that a multi-nutrient with fatty acids, vitamins, minerals, omega-3, omega-6, it reduced antisocial behavior by 26% and it reduced violence by 40%. That was published, like my first trial, almost 20 years ago now. So we did think then, we've got to find a way. So yeah, Fab Research, we have run many, many conferences and events over many years to bring together both researchers and practitioners and to disseminate the information on how food affects behavior, basically how nutrition affects the brain. Right. And again, other pioneers like Rob Lustig, if it comes to the role of sugar and why it really is both toxic and addictive and why ultra-processed foods are such a problem, he's the pioneer in that field. All of these top researchers have given their time to Fab Research for free to come and educate whoever wants to learn. Now, obviously, with lockdown, we've been unable to keep up, the events program. We have a website, though, which is a library database of research studies and also news articles. So I would urge anyone, please tell others, sign up for our free email alerts. And we are also hoping, as soon as we can, raise the funds for the IT systems required, to be running events online, the webinar option, and setting up. We are also developing online professional training courses because we know that this is what is needed. So for medics, at primary care, but also at the level of what we call secondary and tertiary care, the psychiatrist is normally the next referral after the primary care, general practitioner has decided, oh, this might be autism or schizophrenia or whatever. So thank you for the research. Yeah, and I know, Peter, that you and I will keep in touch anyway.
Yes, well, thank you very much for all this information. It was really very, very interesting. Thanks.
Well, very happy to help, and good luck with your initiative to improve the education and awareness.
Thank you, Alec.